Good morning or good afternoon. My name is Charlotte Habracker. I'm President and CEO of Lutheran Services in America, and welcome to today's session on Bridging the Great Health Divide, the linkage between nutrition security and health equity. This is part of our Lutheran Services in America Strength and Service series, which is designed to identify and seize opportunities in today's uncertain environment. I'm very happy today and very pleased to introduce our guest speakers today. First, Dr. Sara Bleich, Director of Nutrition Security and Health Equity at the USDA Food and Nutrition Service, is the first person to hold this position. Dr. Bleich is on leave from her position as a professor of public health policy at Harvard School of Public Health and has been working on research around food insecurity and racial injustice within the social safety net for many years. We are delighted to have her with us today. After she finishes, we'll do a Q&A, so please feel free to put your questions as you go into the chat. We'd love to have a set of questions for Dr. Bleich to respond to. And then we're going to turn to a panel of our members. And I'd like to just introduce them briefly now. First, we have Derek Felder, Chief Operating Officer at Lutheran Social Services of Nevada, Jennifer Freilich, who's Director of Food Pantry Services at Lutheran Social Services of Central Ohio, and Dr. Tiffany Mitchell, Executive Vice President and Chief Operating Officer at Lutheran Social Services of Southern California. So again, we'll have time for discussion later and Q&A, but please put your questions in the chat and we will be sure to get to them. With that, I will turn it over to Dr. Bleich. Thank you for joining us today.
Thank you so much, Charlotte, and good afternoon, everyone. It's great to be with all of you, and let me just reinforce that I would love to hear your questions. So please do put them in the chat and we can take those in a bit. Also want to thank Kimberly and Liz and Alicia for your help in arranging today's webinar and discussion, and really looking forward to hearing from Derek, Jennifer, and Tiffany. So I've heard many good things about this organization and your long history of working with USDA and with the broader social safety net. So just really thanks for everything that you're doing. And it's a real privilege for me to have an opportunity to come and share some of what we're up to at USDA. And I was very happy to see that last week Lutheran Social Services was invited to attend the White House Conference on Hunger, Nutrition, and Health. And I'll talk a little bit more about that later, but would generally love to hear your feedback on the White House Conference and thoughts about how can we work together to achieve our shared goals around ending hunger, reducing diet-related diseases, and the disparities that are associated with them. So as Charlotte said, my name is Sara Bleich, and I serve as the Director of Nutrition Security and Health Equity at the Food Nutrition Service. This is an agency within USDA. I started this position in January, but started with the administration at the start, at inauguration, and spent the first year as a senior advisor for COVID, and then transitioned to the nutrition security lane. So it's been a fascinating almost 2 years. For me, it's been really exciting to witness up close and personal the role of science in the policymaking process. And do like to tell people that this is my second tour of duty in federal service. So I served as a White House fellow during the Obama administration, and then also worked on food and nutrition. Now, with this nutrition security hat on, I've had the opportunity to present a lot in the past several months. And it's been exciting to hear about everyone's enthusiasm from a wide spectrum of stakeholders about the efforts at USDA to tackle food, nutrition, and security. And a piece of that is just recognizing the environment which we live in and the role of structural racism. And I'll talk more about that in a little bit. What I want to try to accomplish in the next 30 minutes or so is just give you an overview of at USDA, how are we thinking about the intersection between nutrition security, health equity, and structural racism, talk about the specific things that we're doing and the tools that we're bringing to bear to really promote and elevate nutrition security, and then how we're leveraging the White House conference from last week on hunger, nutrition, and health to really accelerate progress. And then throughout, I'll try to highlight ways where Lutheran Social Services can help us think through and push toward this goal of tackling food and nutrition insecurity. So very much look forward to your questions. Please do add them. And we'll say that on my end, just want to flag that I'm joined by Ben Marcus, who's one of our key points of contact between USDA and Lutheran Social Services. And then I'm also joined by Dr. Sheila Fleischhacker, who's my assistant, and I'll be sharing a lot of relevant links in the chat. You should feel free to follow up with any of us afterwards, and we'd love to have a continued conversation. So let me jump in with definitions and start with what we mean by nutrition security. So what nutrition security essentially means is consistent and equitable access to healthy, safe, and affordable foods. As I mentioned, we've been talking about this a lot over the past several months. And the number one question that we get is, well, how does nutrition security differ from USDA's longstanding focus, which has been more than 25 years on food insecurity? So let me say a word about that. There really are two distinct differences. The first is that nutrition security recognizes that structural barriers and inequities make it hard for many Americans to maintain an active, healthy life. That's consistent with federal recommendations. And the second is that the nutrition security work at USDA really emphasizes taking an equity lens to our efforts. So if you sort of think about the distinction, food insecurity is really giving people calories, and nutrition insecurity is giving people calories that can really promote their health and well-being. Another important concept that anchors this work is health equity. And so that refers to everyone having an equal opportunity to live the healthiest life possible, no matter who they are, where they live, or how much money they make. And as I mentioned, part of how we are motivating this work is by thinking about the context of structural racism. And so just for the purposes of getting us all on the same page, structural racism is not simply the result of private prejudices that are held by individual people, but it's produced and reproduced by laws and rules and practices that are sanctioned and even implemented by various levels of government and potentially embedded in the economy and societal norms. So then confronting racism requires that we not just change individual attitudes, but we also transform policies. And this is where the nutrition security work is really trying to make a difference. And so just to be a little bit more concrete about the role of structural racism, when I walk you through an example, which is redlining, which you may be familiar with, what this refers to is discriminatory government sanctioned practices that put services like financial services, so things like a mortgage on a house, put them out of reach for Black people. Now, redlining has been officially over for decades, since the Fair Housing Act of 1968. But I mention it because the impact of redlining is still seen today in most American cities in the form of broad social disinvestment. That's with respect to neighborhood infrastructure like green space or roads and services like schools. So the top lines from this slide are that, one, structural racism is real. It reaches back to the beginnings of US history, and it stretches across our institutions and economy. And the second is that structural racism harms health in ways that can be described and measured and dismantled. And again, this is where nutrition security has a role to play at USDA, and where each of you, through your work at Lutheran Social Services, are and can make a really important difference. Now, using an equity lens is a really important component of USDA's strategic approach to tackling food, nutrition, and security. Our secretary at USDA, Secretary Vilsack, gave a speech back in March, which launched off all of our nutrition security work. And then he gave another speech this past June, which talked about our food system transformation work. And what all of those speeches have in common is this clear priority of nutrition security because of the pandemic and our administration's goal to advance racial equity. What COVID-19 did, which you all know well, is that it brought all sorts of disparities. In our case, we're really concerned with health disparities and the vital need for food right up to the forefront. And a study that we often cite at USDA, and you may be familiar with, highlighted that nearly 2/3 of COVID-19 hospitalizations in the US were related to 4 diet-related chronic conditions: obesity, diabetes, hypertension, and heart failure. And what we know is that these are all largely preventable. So then the question is, what do we do about it? We also know that disparities in diet-related diseases are associated with decades of structural limitations to retail food outlets that sell healthier foods. And as you can see on the slide here, there are also inequities in a host of other domains, which many of the services that you all provide touch on. So unemployment, and the list goes on and on. So without question then, promoting food nutrition security is really critical to recovering from the COVID-19 pandemic and ensuring racial equity. So with that background, let's just talk a little bit about the scope of the problem that we're trying to deal with. And the top line is that poor nutrition is the leading cause of death in the US and responsible for more than 600,000 deaths per year. Put another way, 6 in 10 adults are living with one or more diet-related chronic disease. And unfortunately, most Americans do not follow a healthy diet. And so the way that we measure this is something called the Healthy Eating Index, which is measured on a scale from 0 to 100. 0 is the worst, 100 is the best. The average Healthy Eating Index score in the United States is a 58. And what you can see, if you look at the bottom right of the screen, is that we see low scores across all stages of life, which highlights that it's never too late or too early to improve dietary intake. And let's just take a moment. We've talked about the burden, but let's talk about the costs of poor nutrition. So there's a recent study which found that the annual economic burden of healthcare costs from cardiometabolic diseases adds up to about $300 per person or $50 billion annually. And this is just heart disease. You can imagine how these costs increase when you consider all diet-related diseases together. The other important thing to acknowledge just from a context perspective is surging inflation. So we know that prices climbed at the fastest pace in decades in the month leading up to the war in Ukraine. In August, the consumer price index increased by 8.3%. That was down a bit from the 40-year high in June, but still prices are high and we know that families are struggling. The president's top economic priority is addressing inflation. And I'm happy to say that at USDA, several of our nutrition assistance programs are designed to respond to inflation, which means that the benefit levels will adjust to reflect the fact that food prices are shifting. And there are several other steps that USDA has taken to really ensure that people can feed themselves and their families. So one of those is reevaluating the Thrifty Food Plan. And I want to put a pin in that and I'll come back to it. A second is something called emergency allotment. So at USDA, we're delivering nearly $3 billion per month in additional SNAP benefits to eligible households through the emergency allotments. Those are helping working families and seniors. And what they do is they raise up benefit levels if you're on SNAP, which is a supplemental nutrition assistance program, to at least the maximum for their household size. And these will remain available if the federal public health emergency is in place and a state has a public health emergency declaration. The third thing to have on your radar is pandemic EBT. And so these are financial assistance that's for families that have children who would have otherwise received meals at school, so they can use their pandemic EBT benefits to purchase meals. Right now, about 34 states have an approved pandemic EBT plan for school age or preschool age children. And these are reaching about 13.5 million children and delivering about $5.6 billion in benefits. And a key message is that states can apply for these PEBT benefits throughout the school year and then provide these benefits to their families. Do want to also just take a moment and talk about school meals. So many of you, I'm sure, help to provide services to young children, or you yourself have children in school. I have a 9-year-old and 11-year-old. And one of the things that's important to have on your radar is that for the first time in a couple of years, families are going to have to complete an application through their school to determine if their household is eligible for free or reduced price school meals. The reason is because USDA had special authority that expired from Congress, and it expired on June 30th, and that allowed us to offer school meals to all children. Now that that's expired, many students have to start filling out applications. This is important because many families don't know this. It's an important thing that we need to message to make sure that families realize they need to take this step and apply. And it's something they can do at any point during the school year. So there is no deadline, but this is an area where your help in trying to get this messaging out would be very, very helpful. The one other thing that it's totally an aside, but I think it's worth mentioning, that the Food Nutrition Service, which is where I work and Ben works and Sheila works, we are an agency within USDA. And like many other agencies, we help support various legislative vehicles. And the thing that I want to highlight, which is a bit of a tangent, is that typically we work intensely on the Farm Bill and Child Nutrition Reauthorization, which is where our suite of programs are authorized. But the agency has supported 6 legislative packages in the past 2 years, which is just tremendous from the time that it takes to sort of provide the technical assistance and move these things through the process. But the takeaway point is that, like you all, we are very dedicated to make sure that folks have what they have needed throughout the pandemic. And in our case, we're just trying to make sure that folks are fed. We know that you all have been moving heaven and earth to make sure that folks have the social services that they need. So I just want to take the opportunity to say thank you and just really look forward to hearing more about the work that's happening from you all in a few minutes. But I mentioned that I would talk about the Thrifty Food Plan. So let me say a few words about that. So this, the Thrifty Food Plan is basically what serves as the basis for calculating the SNAP benefits. And so we did this back in October of 21, and it resulted in the first permanent increase to the purchasing power of SNAP benefits since the Thrifty was introduced 45 years ago. So a very significant increase. And what it did practically is that it increased monthly benefits by 21% or $36 per person per month. What you can see here on this slide is that this change is a critical step for putting healthy food within reach. Another thing that USDA does is that it adjusts the Thrifty Food Plan for inflation. So this past October, we increased the average size of the SNAP benefit by another 12.5% to reflect food inflation. That is one of the largest inflationary increases in the history of the program. And so all of this is an effort to help make the program meaningful and meet the needs of the individuals that it serves. So now with that background, I just want to switch gears and talk through USDA's actions on nutrition security and give you a sense of what we're trying to do. And before jumping in on nutrition security, I want to acknowledge that as an entire department, the Secretary has identified 5 priority areas. One of them is nutrition security, but the other 4 are addressing climate change through climate smart agriculture and forestry, advancing racial justice, equity, and opportunity, creating more and better market opportunities, and making USDA just a great place for everyone to work. And so, one of the things that it's worth talking about is just how broad the portfolio of USDA is. And you might be getting a sense of that based on those priority areas. But our portfolio is diverse with respect to both our mission and our geographic diversity. So it curbs poverty and hunger, makes credit available for rural development, which is where 1/5 of Americans live, stabilizes domestic farm income, ensures the quality of the food supply, develops markets for agriculture, and conserves and protects natural resources, largely through firefighting. And we have about 100,000 employees and an office in every county in the country. So it makes us one of the larger federal departments. And then what's also unique is that about 90% of our employees at USDA live outside of the national capital region. So they're spread all over the country and in some cases in other parts of the world. Now, when I had on my COVID hat, I learned all sorts of fun facts about USDA, and I just find them so interesting. So I just want to share one with you, which is USDA has the largest firefighting force in the world and the 6th largest Air Force in the world. Now, switching gears to the core part of our mission that I want to talk to you about, that's a suite of more than 15 nutrition assistance programs that we administer at the Food Nutrition Service. And together, they serve 1 in 4 Americans over the course of a year. And as a result, they then reach tens of millions of Americans. This includes more than 41 million Americans through SNAP. Again, that's the Supplemental Nutrition Assistance Program, which formerly is food stamps. More than 30 million children each day through the National School Lunch and Breakfast programs. Nearly half of all infants through the Women, Infants, and Children program, otherwise known as WIC. And this is at about 99,000 schools and 250,000 retailers. Now, in fiscal year 22, the nutrition assistance programs at USDA totaled $163 billion. Traditionally, they represent about 70% of USDA's budget. But because of increased authorities during COVID, they represent currently an even higher percentage. And then in addition to the nutrition assistance programs, we also invest more than $1 billion a year in nutrition education and promotion. We translate the dietary guidelines for Americans through MyPlate, and we also invest in research and food systems. And this is just some of the stuff we're doing in the nutrition security space. If you want to learn more, I encourage you to read this report here, which came out in March and really talks broadly about the motivation and the scaffolding of the actions that we're doing. You can also have a look at the nutrition security web pages, which are updated regularly and give an overview of all the different activities that we have in this space. And all of this work is anchored by 4 pillars, which you can see listed here. And so the first is providing meaningful nutrition support from pregnancy to birth and beyond. The second is connecting all Americans with healthy, safe, affordable food. The third is developing, translating, and enacting nutrition science through partnership. And the fourth is prioritizing equity every step of the way. Now, we also have all of our work being driven by research and grounded in science. And I want to just flag that we have a number of relevant research equities, which includes 6 human nutrition research centers, and that's at our agricultural research service. We also have the Economic Research Service, which does a lot of work in this area. In fact, you might have seen the report that came out just after Labor Day, which showed that household food insecurity for households with children was at a 2-decade low. And then a third key research agency at USDA is the National Institute of Food and Agriculture, which is essentially our extramural funding body. The other thing that I always want to make a point to flag is that our work is driven by lived experiences of our staff, of our stakeholders, and this also includes me. So I'm originally from inner city Baltimore. This is a picture of myself. I'm on the left, my brother and my sister on the right. And when we were little, we received WIC and SNAP and school meals for a period. And the picture where this is taken, this is in Memorial Stadium, or at Memorial Stadium, which is about 1.5 miles from where my parents still live. They live in the same house that I was raised in. But for me, because of this personal connection that I have to the programs, it's just a real privilege to be able to work on them now with this other hat on. So let me just take a few minutes and just run you through the nutrition security pillars, and then I'll transition and just say a few words about the White House Conference. So I mentioned that we have 4 pillars which anchor this work. And so if we start with meaningful support, which is that first one, there are sub-components associated with it. And so if we focus just on that, one of those first bullets, ensuring benefits are adequate to support healthy eating patterns. Here again, I want to just re-flag the reevaluation of the Thrifty Food Plan. That increased the benefit of the SNAP program by 21%, and that was a permanent increase, so a really big deal. Before the end of this calendar year, we expect to be finalizing the Thrifty update for Alaska and Hawaii, and those are dealt with separately. Our next pillar is healthy food, which, as you can see, has 3 subcomponents. Want to focus on that middle one, which is incentive programs. So an example of our work related to incentives is the Gus Schumacher Nutrition Incentive Program. We also have one focused on milk, but for GusNIP, in the second year, the participants redeemed more than $20 million in nutrition incentives. And importantly, they reported increased fruit and vegetable intake and improvements in food security. So really promising findings. And then as part of the food system transformation framework that the Secretary announced in June, there's an additional $40 million to support GusNIP using funding from the American Rescue Plan Act. Now, the third pillar is collaborative action. It's got 4 subcomponents. Want to focus on updating and building the evidence base for dietary guidance. So we at USDA collaborate with the Department of Health and Human Services every 5 years to develop the dietary guidelines for Americans. These are the cornerstone of federal nutrition programs and policies. We are now working to develop the 2030 edition. So many thanks to any of you who submitted nominations to serve on the advisory committee, or if you self-nominated. Our goal is to appoint the committee, the Dietary Guidelines Advisory Committee, in early 2023, so sometime after January. And this will really kickstart the work in this area, and there'll be a number of public meetings. And there's opportunities for oral and written comments. So really encourage all of you to engage in this process as it makes sense. Do want to highlight our collaborative work through SNAP Ed. So that's SNAP Education. It's a component of the SNAP program which focuses on educating individuals who are eligible for SNAP to promote healthy eating, physical activity. Importantly, we've made some recent changes to this program. For the first time in the history of our agency, we have a new branch that's dedicated to nutrition education. We've also improved data collection, and we have a national reporting system, which is going to make it possible to track outcomes across the country in a comparable way. We are also, through our state guidance, encouraging maximum flexibility in the use of policy, systems, and environmental change approaches. And this is the idea that it's not just direct one-on-one nutrition education, but it's thinking, how do we change environments in ways that really promote healthy eating and promote physical activity? And then our last pillar is equitable systems. You can see it's got 5 subcomponents, and want to highlight the first related to our work with Native populations. So one good example of our equity efforts is how our Office of Tribal Relations recently launched the Indigenous Food Sovereignty Initiative, which essentially promotes traditional foodways and Indian country food and agricultural markets. And they have lots of other exciting work underway. So I would encourage you to have a look at their website if you want to learn more. Do want to flag that as we think about equity, we have to consider that a number of our programs are underutilized. So we know, for example, that 1 in 5 eligible for SNAP do not participate in the program. About 1 in 2 eligible for WIC do not participate. We are making significant investments in this area with funding from the American Rescue Plan. And then the third is that about 30 million kids, as we talked about, participate in meals during the school year, but it's only about half of that in the summer. So these are 3 areas where we would really look to you all to help us push eligible individuals toward these programs because you are a trusted voice in the community. Now, before turning to the White House conference, which I'll go through quickly, we'll just say that as we've been pushing toward nutrition security, we're taking a 2-phased approach. We've spent in the first phase a lot of time on external communications. What are we doing? What are our equities? And now we're really thinking strategically about future investments, trying to really define our lane so that it's clear where others can step in and provide complementary value. And so just would love to hear your ideas, both in terms of what you're up to, how we can be supportive, and then where you see areas of synergy. Now, I want to turn and just spend a few minutes focusing on the White House conference. So it was last week. It was very exciting. Hadn't happened in 50 years. Had the goal of, has the goal of ending hunger and reducing diet-related diseases in the US by 2030, all while reducing disparities. So very important goals. I will say for me personally, one of the best parts was having the opportunity to hear from a number of individuals with lived experience who are currently participating in the various programs, but also just to hear so much excitement from colleagues and new stakeholders that were new to me about just how much excitement there is for the work ahead. And then more than $8 billion of non-federal commitments were announced to help advance the conference goals. Now, the day before the conference, a federal strategy was released, which is meant to sort of provide a blueprint for how we're going to make a path toward the conference goals. So there are 5 pillars that you can see here that are associated with the national strategy. We'll just say that the national strategy is truly a whole of government effort. So about 20 different federal agencies have worked tirelessly over the past several months to put that document together. I had the privilege of serving on the planning committee along with Kumar Chandran, who's also at USDA. And then there were also a lot of listening sessions, which many of you may have participated in. So thank you for your input if you had an opportunity to lean in. There is so much that each of us can do in small ways and big ways, and it all adds up. So just encourage you, you're obviously already doing a lot, but just appreciate it and encourage you to maybe do even more if you're able to. Now at USDA, we also released a report talking specifically about the food nutrition service and how we are leveraging the conference to help promote and elevate nutrition security. So I encourage you to have a look at this report because it explains who we are, who we serve, and then what is some of the key work underway, which may dovetail with some of what you're working on. Now, within each of the 5 national strategy pillars, we have key USDA equities in each of those. In the interest of time, I'm not going to run through those because we're about at the half-an-hour mark. I want to skip ahead and just talk quickly about several efforts that we have underway that we think will advance nutrition security. And so, as I mentioned, we are updating the Thrifty Food Plan by issuing the Alaska and Hawaii updates. We are updating the WIC food package before the end of the calendar year with science-informed changes and updating school meal standards also before the end of the calendar year to be consistent with the dietary guidelines. I also mentioned a couple other things that are listed here, including initiating the next edition of the dietary guidelines for Americans. I am very pleased to say that in the president's fiscal year 23 budget, there was $23 million specifically for nutrition security, which is very exciting, in addition to lots of other game-changing investments that are going to keep pushing forward these programs, such as ensuring the cash value benefit voucher for women participating in WIC and for children to ensure that women receive through 2023 the recommended levels of fruits and vegetables. So final slide before we transition to your thoughts and questions. I just want to leave you with 3 thoughts. The first is that now is really the time to lean in. Food insecurity is high, diet-related diseases are high and rising, and both of them disproportionately impact historically underserved populations. The second is that, at USDA, we are really trying to not just provide all Americans with access to safe, nutritious, affordable food, but also to help them understand how to prepare it on a limited budget and facilitate consumption across a range of life stages and food preferences. To the extent to which you are a trusted messenger with different populations who you think would benefit from our services, we would greatly appreciate your help in going that last mile and helping to connect people with programs they're eligible for. And then the last thing is that at USDA, we are obviously committing a lot of financial resources, a lot of personal resources towards this effort, but we cannot do it alone. And so we are looking for ways to engage, to collaborate. So just really appreciate you all making time for us to learn about what we're up to, and really look forward to hearing what you're all doing through Lutheran Social Services, and then thinking constructively about what are some of the different ways we can think about collaborating and working together. So thank you very much. Let me stop here and look forward to your questions.
Thank you so much, Sarah. That was fabulous and very informative, and really look forward to delving a little bit more into your materials. And with that, we do have one question, and I know everybody else is getting ready to put their questions in the chat, or feel free to raise your hand. And the question is, how can the USDA partner with churches and congregations that have food pantries or community gardens?
Yeah, so great question. A couple different ways. So within USDA, we have an Office of Faith-Based Partnerships, and that's one way that we work a lot with the faith-based communities to help us both push the word out about all the various programs that we're offering, but also to think constructively about, how do we make sure that we're targeting resources. Within the food nutrition service, we have programs which are designed to provide funding to food banks, like the Emergency Food Assistance Program, which received a big bolus of money throughout the pandemic, to help make sure that food banks have sufficient funding to provide services to those in need. So if you have specific questions about how you can connect your organization into some of the resources at USDA, I would encourage you to reach directly out to me, and I'm happy to put my email in the chat, or reach out to Sheila, or reach out to Ben, and we can have a more nuanced conversation about the different opportunities that are available at USDA.
Great, thank you. Other questions? And you can take yourself off mute and give the question, or type it in the chat.
Jennifer Freilich, LSS, Central Ohio. Quick question. So the funding that goes to food banks, certainly those of us who are food pantries and partner agencies, we do, get food from them. However, the actual dollars are not available to actual pantries. So I don't know if there's any suggestions on other ways to access that type of funding.
Yeah, it's a great point. So stepping back for a second, so the way that USDA is distributing money through the Emergency Food Assistance Program, which we call TFAP, is that it is flowing into the food banks, who then distribute it throughout the food pantries. Would say that generally we are hearing around the country that food banks are struggling because of supply chain problems, and also donations are down. So we are very much aware of those challenges. We actually had an opportunity the day before the White House conference to meet with more than 20 different representatives from food banks, just to hear where some of the challenges are. So the point that you raised, Jennifer, did also come up then. I would say that largely because of the White House conference, there is so much energy and enthusiasm about trying to help march forward towards the conference goals. So I do think this is a window of opportunity for those who are working on the front lines to look to philanthropy, to look to corporate donors and say, like, do you want to try to contribute to our efforts? I'm sure all of you have a profound story to tell about the work that you're doing and how an additional X amount of dollars can make a big difference. Would encourage you to think about that. On the White House website, there is a news release which details all the different commitments that total over $8 billion. There are 60 some of them. It'll give you some idea about where those commitments are going, and maybe even some ideas about who to potentially reach out to think about ways to garner additional support. Because I think, one of our main messages is we are really trying to do a lot, but we can't solve this problem at USDA. We, federal government, can't solve this problem. And this is why with the White House conference, it's really been billed as a whole of country approach that's needed to end hunger and reduce diet-related diseases and disparities.
Okay, thank you. Other questions? I do notice a comment, not a question, in the chat that says, just wanted to say that Dr. Bleich is incredibly impressive and excited she's here to help all of us in America.
Well, that's very kind. I'm very excited to be with all of you. And maybe this is a good time to transition so we can hear from you all about the work that you're doing.
Exactly. Thank you so much. And with that, I'd like to introduce Derek Felder, who is with Lutheran Social Services of Nevada. Derek.
Yes. Good morning to the West Coast and good afternoon to the East Coast participants. My name is Derek Felder. I'm the COO for Lutheran Social Services of Nevada. And we are located in Southern Nevada and serving the surrounding area. LSSN has a focus on serving the community through our various programs. Services include birth certificate identification services, SNAP signups assistance, 2 senior congregate meal sites, rental utility assistance, employment navigation, which is our newest program. And our main focus or main service is our Digimart food pantry that serves the community with USDA and donated food items to address the food insecurity in the Las Vegas Valley and the surrounding area. Our agency originally launched our digital platform for our food pantry back in 2016 to service basically anyone that was in assistance, living in a food desert, because we noticed a high volume of shoppers that access our pantries on a regular day. We decided that a digital platform will basically help individuals that are working, that can't make it through the week, they can plan out their shopping trip to come visit us. And so when we provide our donated items and our USDA items, that digital platform would afford them the opportunity to actually look at the nutritional value of each one of those items. So they can shop smart. And along with our nutrition education program, they would learn what items have healthy nutritional value. And they can also attend our Cooking Matters courses, which teach them how to prepare those meals in a healthy way and to stretch those meals. Our digital platform also afforded them the opportunity to learn how to budget, because items in that system would carry point values. And each household member would have 100 points, capping at 500. So they would learn how to shop once a month and learn how to budget. And this would also help them with their financial income that they have coming in as well. And so with this platform that we had, we also opened it up to people that can shop from home, but we also had kiosks on site. So individuals that may not have the technology would also come in and sit down, sit with our volunteers, and they can get walked through that process, which is very user-friendly. And our shoppers would be able to select those items because with our Digimart system, they're color-coded. So items that hold good nutritional value would have a green background, and items that didn't hold so much nutritional value would have a red, and items in between would have a yellow. And so the items that are green that hold that nutritional value would actually be lower points, because we want to encourage people to shop smarter and choose healthier food. And so our shoppers realize that the value of selecting those items, you can get more items during your shopping trip. And another way that we've reached out to our community is back in 2010, we launched what we called open air markets. It's essentially like a free farmers market around the valleys. And the way we kind of focus this is we look for those food deserts based on the information that we gather at our location, based on zip codes and the amount of need we see. We would actually target those areas and partner with agencies, with churches, with businesses, and conduct this 4-hour event in a parking lot. And we would serve anywhere between 250 to 300 households coming through in that 4-hour period. So we are very proud of that program, because we began to see buy-in from churches and other businesses that wanted to service their community. And so with the use of those donated items and USDA items, we're really able to expand our reach in our community, and we hope to have this grow even further. And during the pandemic, we did have a problem with getting certain items in. Our local food bank also launched several pop-up sites to help address the food insecurities. And as they scale those back, we're starting to see more people coming through. So we appreciate this opportunity to partner with our local food bank and USDA to get this food back into the community.
Great. Thank you so much, Derek. And if I remember, you all did get an award for your digital food bank a couple of years ago as well. So again, congratulations.
Yes. I would like to pass it now over to Tiffany. Oh, I'm sorry, to Jennifer.
Thank you.
All right. Thank you. Thank you, Derek. It's great to hear about what you're doing on the other side of the country. We too offer digital ordering for our food pantries. And in LSS of Central Ohio, we have a network of food pantries as well as mobile food distributions, very similar to your open air markets. Across 11 counties in Central Ohio. So our flagship location where we're really doing the most service is located on the south side of Columbus. This is an underserved area designated that vulnerable by the Ohio Department of Health, and we serve about 5,000 unduplicated people per month at what we call our Champion Avenue Food Pantry. And we do offer the online pre-ordering, and people will select using points, much like Derek, those choices of both foods, but there's also a significant portion of the offerings that are personal care items and household supplies. So we've used, doing the digital ordering and maintaining a live inventory has allowed us to use data to determine those items that people are choosing. So essentially they're voting with their points. So this, along with survey data and definitely lots of listening, has led us to realize that the most important things we can offer to people, in addition to food, to allow them to stretch their food dollar, would be things: toilet paper, paper towels, those items that you're not able to use SNAP benefits to purchase, as well as key personal care items. So, so in addition to that, we also offer fresh produce, frozen meat, and milk, fluid milk, and eggs. So we have switched our food, our purchasing dollars to focus on those items that truly would be difficult to get, to truly allow people to stretch what they're getting from us. And we have a huge focus on fresh produce. We're fortunate to be a partner agency of the Mid-Ohio Food Collective, which is our food bank in the area. And they made a commitment over 8 years ago to ensure that well over 50% of what they provided to agencies was fresh produce. So we are able to leverage that food that we get from them, and our donated dollars and donated food items to truly fill out those gaps that people have. And in addition to this, we provide nutrition education on really managing food dollars and meal planning. We partner with local educational institutions and their dietetics programs to do that. One thing too that we are actively engaged in right now, in fact, we just pressed send on a community food programs grant for USDA. So fingers crossed on that one. Yay. We have partnered with amazing people in our community here on south side of Columbus to envision a true, we're trying to establish a local food system really through urban gardening. And there's so much interest here and passion around it that that we are hoping to leverage the partnership and get, the money to be able to truly make this a place where education and growth can happen in our community. It's got a strong youth initiative and focusing as in all our programs, on hiring people with lived experiences and paying, being able to pay them, especially the younger folks, to get them excited about careers in agriculture. So we're really excited about that, and how we really are doing the work, and everything through an equity lens. We are listening. I've been doing this kind of work for over 20 years, and the only way to truly put together something with impact is to start with we're person-centered. The people you serve, they're the reason for our work. That's where we start. And so getting their opinions, through surveys, listening sessions, just talking, you learn about what's really important and how to truly address those barriers. So with that, I am going to turn it over to Tiffany.
Okay. Good morning, everyone, or afternoon. I'm on the West Coast, so it's not quite noon yet, but good afternoon. I'm Tiffany Mitchell. I'm the Chief Operating Officer at Lutheran Social Services of Southern California. And LSS SoCal has been around for 78 years. We started off in San Diego and have now expanded throughout Southern California. So we operate in about 6 out of the 10 SoCal counties. And we have about 15 locations throughout Southern California. Most of our locations are in San Bernardino County. And a little bit about what we do is we provide services across the board, looking from education to housing, to mental health, to senior services. And everything that we do is through an 8-dimension wellness model. So we're really looking to serve the whole person. And I know today we're discussing food and nutrition. And so that kind of touches on the 6th dimension of our wellness model, which is physical. And at all of our sites, we provide food pantries. It's kind of the origins of the organization started off by providing basic needs to the communities that we serve. And so that was food, clothing, and shelter. And so at every site, we provide an opportunity to equip our clients with food and resources to kind of help them through whatever they're going through day to day. What I do want to talk about is what we're doing in San Bernardino County. So San Bernardino is one of the largest counties in the 48 contiguous states, and it's one of the poorest. And so we know that in San Bernardino County, because such a huge landmass, there are a lot of rural areas. So beyond just having individuals or families experience housing or food insecurity, there's also a lot of geographical isolation. And so what we're trying to do is make sure that we can reach all people within that county. And so what we're currently working on is building out what we're calling our community wellness campus. And one of the key components of this community wellness campus is really to focus on both housing, but also food and nutrition. And so one of the things that we're developing out currently on this campus is a community market. So traditionally, in all of our locations, we have a pantry. We give out groceries. Sometimes clients get the opportunity to pick and choose what they want that's meaningful for them and their families. But we're doing something a little bit different in San Bernardino. We are creating a shopping experience, and it's probably somewhat similar to what my counterparts have already discussed at their locations, but we're creating an equitable and kind of dignified shopping experience for the clients that we serve. And so we're building out something that will look very similar to a local grocery store. Clients have a shopping cart and they get the ability to come in and really pick culturally nutritious food that really represents their lifestyle and kind of the needs of their family. And so we will have nutritionists and staff and volunteers really supporting clients during their shopping experience, making sure that they're getting all the items that they need to really make healthy, nutritious meals for themselves at home. And of course, one of the things that we're really taking into consideration is the fact that everyone's living conditions are a little bit different. So someone living in an apartment needs something very different than maybe someone who's living in a shelter. And so we are really tailoring the experience to meet the needs of those that we're serving. And so once we kind of get this model kind of built out, our goal is to kind of take this concept and embed it in every single community that we serve in. So it's an exciting project. We're partnering with a lot of organizations, food pantries, and even large or major grocers that are supportive of this concept and idea, and really want to see it come to fruition, especially in San Bernardino County. Although this market is going to be stationary, one of the things that we're going to do to make sure that we can get the food services out to the rural parts of the county is we have mobile wellness vehicles. And so these outreach vehicles have been, they're like large buses or vans that we've retrofitted so that we can provide a shopping experience in this vehicle, and we can take it into communities, and we're still be able to serve those who can't come directly to our community market. So thank you for allowing me to share a little bit of what we're doing in San Bernardino.
Great. Thank you so much. And, thank you to all of you for all of the incredibly innovative and impactful programs that you're running. We do have a few minutes for questions. So please, either raise your hand, shout out a question, or just put it in the chat. Does anybody have any questions? And Sarah, you can ask our members questions too if you want to. Go ahead.
Thanks. I was just raising my hand. Well, I wanted to say, and this is both for Tiffany, Jennifer, and Derek, but anyone who's listening, we have at USDA, or at the Food Nutrition Service, we have regional offices around the country, and we are often looking for opportunities for our political leadership to go out and just see on the ground what's happening. And so to the extent to which you are connected up with any of the USDA programs and you'd like to just showcase the work that you're doing, we would love to incorporate it into some of our site visits. I personally would love to come see some of this. So you can either reach out to us directly to connect with the regional offices, or you can find their contact on the USDA website. But it's so helpful for us to see what's happening on the ground in with our own eyes. And then we can take that back, share with other parts of the country, but also use it to help inform the policies that we're creating and make sure that sort of they make sense from a practical on the ground perspective.
We will definitely take you up on that offer, and I'm sure our members will as well. Other questions before we end? Nobody else? Well, I want to thank Sarah, Derek, Jennifer, Tiffany for sharing their thoughts. Thank you to USDA for your leadership in this area. Thank you to our members for the incredible work that you do. Thank you for the participants today in the session. Kim will be sending an email out afterwards with all the materials, with the recording of this session. And we will be letting you know about upcoming Strength and Service series. So again, thank you so much. Good to see everybody.